What's up, everybody? Dave Seidel here with American Health Plans, back with our sales manager, Brian Ollie. Wanted to give you guys some tips here today on how to save money on your health insurance, okay? Now, anybody who's purchased health insurance in the last couple of years is probably aware that rates have been going up. Things are also changing, a lot all the time. So wanted to give you guys some tips and also some strategies that we recommend to our clients. And this will just be a little overview for you guys. As I've mentioned in our other videos, if you want more information, you can always go to our website. We'll post links in the description below if you're watching on YouTube. And always the best way actually is to just give us a call. We're happy to go over it with you in more detail that way too, okay? So Brian's gonna go over a scenario with you guys so you can kind of visualize it and better understand what he's talking about, and we'll go from there, okay?
Perfect. So everybody calls up these days, Dave, looking for a low deductible.
Right.
Yes, it might seem like you're getting better benefits, but we all know low deductible plans are very, very expensive. $0 deductible plans are almost impossible to find or even qualify for these days without paying an arm and a leg. My professional opinion, if you're healthy, there's no reason to get a low deductible unless you're going to have a baby that year, so within 9 months, or have a major surgery. And you should know these things coming up ahead of time. Yes, there's a couple cases for unplanned scenarios, but my professional opinion, the way to save money the best is to go with a high deductible, especially if you're healthy. You're going to save that monthly premium to use for other bills. But let's touch base a little bit on what a deductible actually means. Most people don't know they're on the right track, but maybe don't know everything about it. Do you kind of know what a deductible is, Dave?
I have an idea. I'm not an expert like you are, Brian, but what I would say is basically that's what you have to pay before the insurance kicks in, okay? So that wouldn't include any of your co-pays, but anything like blood work or some other thing that you might go in for, that'll start counting towards your deductible. Once you hit it, then the insurance will cover the rest of it.
Perfect. I mean, you hit the nail on the head. So co-pays are before deductible, fixed rates, $10, $20, $40, $50 for doctor visits. Again, those don't go towards that total. The way that I think about a deductible, it's more or less a benchmark. It's not a hanging debt. You don't have to pay $5,000, $7,000 before your insurance helps you out. They're going to help you out with in-network discounts and those co-pays before deductible, and that's what we use most. So that's what I would focus on the most. Let's look at that scenario you're talking about here, Dave. I have plan A and plan B, okay? Plan A is pretty realistic, average policy, around $200 a month with a $3,000 deductible. That's fairly low. Again, the lower we go, it's gonna be more per month. Think of it as a teeter-totter effect there. $0 deductible, you're probably gonna be $500, $600. I don't know if you use your insurance that much. So this is about an average low deductible plan. What you see a lot of is $7,500. That's the marketplace's max deductible per person. Now this plan is going to be closer to about $100 per month. So as you can see, $160 is, I added extra coverage there. So not only did we go with a higher deductible, I saved enough money to add extra coverage. The total is still less than plan A. So in plan A, if you had a $200 a month healthy individual and you go to the doctors twice a year, let's say, your doctor visit's gonna be $50, so there's $100, and then maybe you get some blood work, $100 a piece. You're at about $300 towards that deductible. A healthy individual is not gonna hit $3,000 in 1 year, so you're kind of throwing your money away month to month there. Plan B here, you have a $7,500 deductible. Still, you go in for 2 visits a year, $50 per visit, it's $100. You get the same lab test done, $100 a piece. You're still at $300. Yes, you're not gonna hit that in this year, but I left enough room to add $60 of extra coverage. We call it hospitalization coverage or deductible protection. So if you want to write that down, what that is a supplement. Okay, it's also referred to as gap coverage. It's going to cover the holes that you have in your plan. A big hole is a deductible. So what your supplemental $60 per month policy is going to do for you, it's going to cover you on any accidents. Stitches to broken bones, car accident, major surgery. It's going to help you out with your emergency room, your hospital care, everything that comes from that accident. You might have remembered us talking about this on past channels there. So accident's a big portion. We also have critical illness, so that's going to cover you on heart attack, stroke, cancer. The big 3 bills that we are scared of, and that's why we get insurance in the first place. We also have a supplement called hospital confinement. That's going to cover your hospital bills for everything in between that. Kidney stones, asthma attack, emergency room, hospital care. $60 a month extra. I know no one likes paying an extra bill, but $60 a month over the span of 12 months is only $720 per year, and it'll waive $75,000 to $10,000 worth of deductible. I mean, I don't know about you, Dave, but $750 as opposed to $7,500, it's a no-brainer.
Yeah.
And you're saving money from Plan A. You're still saving $40 a month to either use towards those doctor's copays or prescriptions you might have out of pocket. Does that make sense?
Yeah, for sure. So if I understand correctly, basically the Plan B scenario that you described here, you're covered not only on the back end after deductible, but you're also covered more on the front end for the most common reasons that you have to pay that high deductible. Is that correct?
Correct.
Okay.
Both companies are going to cover you over and above your deductible, but no one wants to pay $3,000 or $7,500. That's where this supplement comes into place. As you noticed, Plan A doesn't have any supplement at all, so you're still responsible for all $3,000 if anything were to happen to you, plus $200 a month. Here, if you get an accident or a critical illness, this is waived for you by your supplement, and you're saving money. You're at $160 a month for better coverage, less per month. So that's where we try to steer everybody into, just to help you save money and get better benefits, because you're still paying out of pocket with a low deductible there.
Right.
Another big thing that I wanted to point out here, Dave, is everyone kind of gets caught up on the small bells and whistles. They might only go to 1, 2, 3 doctor visits a year. Again, those don't cost a lot out of pocket. Normal doctor visits should only run you $50 to $100 with no insurance. So if you don't go that much, maybe look at a couple catastrophic plans, high deductible, just cover you for the big stuff. You're going to save month to month to pay for your doctor visits out of pocket. Also prescription coverage. Everyone calls and wants prescription coverage because I think it just comes as a package. It doesn't. We can really break it down for you. I ask all my clients, if you take just generic prescriptions, you don't need to add extra prescription coverage on. It's just going to be another bill and your monthly premium is going to go up. So we'll help you find other ways to get those prescriptions lower. A couple websites you can use free of charge, print off coupons and discounts in your area. One is goodrx.com. Dave will post that below this video. goodrx.com and Blink Health. Both of those are very user-friendly. You hop on, you type in your zip code, you type in your prescription, it'll even help you spell it. You look up your dosage. You can even buy in bulk, but it'll give you the cheapest price in your area. Walmart, Kmart, Kroger, CVS Pharmacy, all your local chain pharmacies. So check that out even today to help you start saving money. If you need any extra help, give us a call. We'll play with your deductible, add extra supplemental coverage on for you, and get you the better policy. The way I kind of look at it, Dave, is we don't buy auto insurance to cover, scratch and dings in a parking lot. Right. You're going to take your car home, you're going to fix it yourself. You don't want to pay those huge auto part pricings. We buy auto insurance to cover us if you get in a wreck. I mean, now it's a couple $1,000s, maybe even gets rid of your car, you have to get a new one. So yeah, that's what the real reason for insurance. So you're going to want to try to save as much money as you can month to month, especially if you're healthy. You're not going to use it every single month, but you're still paying that monthly premium.
For sure, man. Great example, great information. So hopefully that helps you guys. Just again, to give you some more information out there. Don't, just because there's a certain way that things have always been done or a traditional way doesn't mean it's always the best. Things are changing. There are other options. It might not be for everybody, but it's at least worth considering and looking into a little bit further. So again, hopefully that information helps you guys. Give us a call. Visit our website if you want to learn more. Thanks for stopping by. We'll see you in the next one.